Your phone may be destroying your neck. Neck pain, headaches, shoulder tightness, numbness, tingling, and upper back pain are all signs of tech neck, caused by hours spent looking down at phones, laptops, and screens every day. If ignored, the damage can become permanent. Join Dr. Tom Roselle for a powerful free health class and learn natural solutions to relieve pain, improve posture, and protect your spine. Wednesday, June 17th at 6 p.m. at the Roselle Center for Healing. Seats are limited. Call 703-698-7117 or register now at rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom, right here on WMAL 105.9 in your nation's capital. And hopefully that you're listening to us on an ongoing basis because we got so much information to give you, so many things that are important. And this is one of them, as a matter of fact. We're going to continue our discussion on how your technology is kind of messing you up and really causing you some significant problems. And you're going to be very interested to hear what we're going to kind of share with you relative to chronic pain patterns, when you hurt all over the place. And could it come from your technology? Oh, you bet. And that's one of the things we want you to understand, because some of you have got to make some major modifications. I want to remind you, coming up this coming Wednesday evening, the 17th, at the Roselle Center in Fairfax, Virginia. We're right off the National Capital Beltway, not too far, probably 3/4 of a mile once you turn onto Route 50. And we're going to be doing an in-house presentation. Technically, you like that word, technically? It's called Tech Neck. And it means your technology is busting up your neck, your shoulders, and so forth. You've heard me talk about if you move your head in a downward position just about 15 degrees, you're putting about 45 pounds of weight on your neck and shoulders in a pendulum effect, that good old noggin of yours. And it's really true. But more importantly, you're really hurting the spinal cord and that downstream effect it has all over the place. So we're going to talk about something that is been known as the UN disease, and guess who coined that? It's called yours truly. Many years ago, I wrote a white paper and talked about fibromyalgia, the UN disease. Now, fibromyalgia in the medical circles in the allopathic community is ruled in by ruling everything else out. And that's not the way you do anything as far as I'm concerned. So is there a way of really identifying what fibromyalgia is? And the short answer is absolutely yes. There's a lot of things that finger point, and nobody wants to take the time to really do that. Now, a lot of the work that I did goes way back to about 1987 and the American College of Rheumatology, and we'll talk about what they said about it then and continue to hold true. And then the question becomes, why are so many physicians, and I'll use the word lazy, not willing to do the diagnostics that will lead them to be able to treat patients? The number one drug, and if they don't have a drug, they can't fix it. Number one drug that they use to fix fibromyalgia is Lyrica, and it's actually an anti-seizure drug. But is that the way to go? My opinion, no, not, because it doesn't fix anything. It's nothing that resolves the issue. So let's get into it just a little bit and make sure you understand that that technology that you're using with your head in a downward position, that your 3 screens and your laptop and 3 phones and so forth, and you're sitting at your desk all day long, has a very definite, devastating effect on your entire body. And on the 17th, this coming Wednesday evening, we're going to go through that, but we're going to show you the other implications, the organ systems that are being affected, your eyes, the squealing that you get in your ears, the high-pitched sounds, the gravel-gurdy sounds, the low-pitched sounds. All of those things can and often are a result of your technology. And we want you to understand that you got to make some decisions, my friends. You got to change a few things. Otherwise, there's going to be issues. By the way, I want you to register for that class. Right, you can do it right now if you're listening to me, because you don't have to turn me off. You can just get on, get another screen, so you know how technology works, right? And so what you're going to do is you're going to go to drtomroselle.com, DRTOMROSELLE, drtomroselle.com. And it's going to pop up, and you're going to have a place to register and make it happen. The only thing, by the way, you remember all these classes are a gift to you, and there's no admission fee. We're not going to try to sell you a timeshare anywhere down. This is, you take the information, you can take pictures of the screens and everything that we put up there, and trust me, there's going to be a lot of data here, and say, hey, thanks, I really appreciate that. I'm going to go give it a try. But if you can't make it and you do register, the only thing that we ask you to do is give us a buzz and say, listen, something came up, I can't make it. That way we have room for somebody else. So here's the phone number that you can do that with. You go to 703-698-7117. That's 703-698-7117. And we've got a great staff, and they'll say, oh, I wish you could be here. And they'll take you off the list. But register right now. Go to drtomroselle.com. Let's get into the meat of this thing. Let's talk about this undisease and how it's affecting your body. First, I want you to know something, and this is actual data. It is the most misdiagnosed condition of the 21st century. And at one point, you go to a doc, you say, I hurt all over, and you say, well, you got myofasciitis. Well, they didn't really know what that meant. And it's confused with other things like chronic fatigue syndrome, because did you know that with chronic fatigue syndrome, the old mononucleosis, that you can hurt like crazy? Things like fungal infections, polysystemic chronic candidiasis, anemia problems, toxic immune disorders, all kinds of stuff. Now, it means that you do have to rule out these things, but there are very specific things. It's when you deal with fibromyalgia, it is a full body pain syndrome. But here's the thing that you have to remember. It does not affect your joints. It does not affect your shoulders and your elbows and your wrists and your knees and your ankles and so forth. It's in, feels soft tissue, but it's all over. And to be diagnosed properly, you have to have pain in all four quadrants. What does that mean? That means the upper right, the lower, the upper left, the lower right, the lower left, in the tissue, in the muscular tissue. It aches, it's stiff, it screws up your sleep cycle. Now look, it's not one of those things that go away. When you get this disorder, it begins to ramp up. And according to the American College of Rheumatology, you have to have this for at least 3 months. 3 months. Doesn't go away. It doesn't go up and down and up and down and up and down. It hits, it starts ramping. And it hurts, and it's always there, and doesn't make any difference what you do. It just never goes away. Now, here's a diagnostic that we use all the time with our patients. If you come in and you tell me that I hurt all over, obviously we're going to do a lot of testing, and testing is not invasive. We're not going to do all kinds of crazy with you. But here's one simple test. I'll put your arm in my hand, and you tell me, just my body hurts, my upper shoulders, my legs, and so forth, and I'm going to lift your arm. If it doesn't hurt when I lift it, there's a good indication that it may be somewhere in the neighborhood of a fibromyalgia. It's one of the diagnostic criteria. If you lift it, it hurts like crazy, right? Because you've got to engage the soft tissue. But if you don't use the soft tissue at all, and the pain in your shoulders and your arms and chest and so forth modifies, that tells me that we're maybe looking down the right path, but we have to do other things as well. Now, the laboratory signals, according to the medical community, and I say signals, the reports show nothing, because they're looking at it from a very traditional way. But I want you to know that, in fact, there are ways, if you know what you're looking for, to determine absolute positive signaling relative to the biochemical, bioelectrical pathways, and they do show up on the laboratory platform. We're going to talk about just a little bit about that, because I'm going to really get into it on Wednesday evening. Dr. Scott Lamp and I will be going back and forth. And if you ever heard the two of us, we kind of have fun. But you're going to get a ton of data. I'm telling you, you're going to get so much information and things that we're going to show you what to do, how to do it, how to position yourself, and really make a difference. So here's the deal. Did you know that the majority, obviously, of fibromyalgia patients are adults. That's kind of a, yeah, okay, why? So the other piece is that women are 7 to 9 times more affected by this than men are. So that starts telling you there's maybe a hormone something that's going on here. Could it be estrogenic? Could it be testosterone? Could it be? So here's the thing. Now I want you to think about this. I'll go over it. Ladies, when you produce testosterone in your body, where you produce testosterone in your body is only in one place. It's in the outer shell of your fight-flight system called your adrenal glands, and they sit on top of your kidneys. Your adrenal glands, your fight-flight system, regulates everything in your body, but testosterone is that's the only place. Now, once you go through menopause, guess what? That's the only place you produce estrogen. It's the only place you produce progesterone there. So, guys, yeah, you got a leg up because you do it in two places. You got the adrenal system, and you also have your testicular tissue, both places. So could that be a little bit of maybe that's coming from there? Yeah, maybe. But the onsets are important. You have to walk it through. So the average age of onset is somewhere in the neighborhood of 20-something to up to about 50 years of age. All right, so that gives us another clue. And we're talking about clues. And here's the other clue. Guess what? More Caucasians have a problem than people of color. Did you hear me? Yeah, the folks that are from different parts of the world and even in the Mediterranean, where my family's from, not as much. But when you're pure white and bred in the good old USA, guess what? You may have a much greater problem, and that's not sexist, it's not racial, it's just the way it is. That's the data. And the low onset of presentation in children, it's really low. It's about 1.5, 1.6% when it comes to children and teenagers. So there has to be something that's going on that may cause that, but they kind of overlook it, right? So the persistence of symptoms and affecting multiple systems within the body is something that we have to think through. I said earlier, profound fatigue, it wipes you out. And then you get into depression. Now, depression happens because of attitude, but it also happens biochemically. And then you start looking at things like serotonin and dopamine. And so serotonin is your feel-good juice. Dopamine is your motivation to do things. And so could there be a problem there? So we're going to look at where those two things come from. And by the way, as a group, they're called what? Neurotransmitters. And they're produced about 80% in the intestinal tract and 20% in the brain or the brainstem. So we begin to say, okay, what happened here? Now what we're noticing is that there's a tremendous amount of correlation between different areas of pain. Now, the American College of Rheumatology says that you have to have pain in all four quadrants. Okay, great. We talked about that. Now that means upper right, left, upper left, lower right, lower left. But it's not in the joints, remember? And here's the other piece. There's no swelling. There's no inflammation that is primarily associated with a fibromyalgia condition. So what's that got to do with your technique? What's that got to do with, how this all started? Well, what we're seeing is that there's a correlation more and more today because the numbers are going up. The incidence is much more significant in people who are desk jockeys, computer guys, you sit around all day long and you got your nose in the book, you got your nose in the computer. Yeah, that's straight up. So if that's the case, what else could cause it? Well, in my almost 5 decades of practice, what I notice is that virtually across the board, there has been some irritation to the neck, either from an accident, a fall, a blow, a trauma, things of that nature, how people sleep on their stomach with their head turned. But now we're in the world of technology and your head is down into your, the other day I was out for a ride and I do those things sometimes just to get my head clear. And I was with my wife and she was in the car. We went for a long ride, about 4 hours actually. We went out to West and came back. And I was watching this young man and he had a backpack on. And it looked like, he had waited and he was running. He was trying to, get in shape. And I said, good for him. Until I got side to side with him and I noticed he had his cell phone in his hand and his head was down. And I'm saying, you've got to be kidding me. Really? I wanted to stop. If the traffic wasn't as heavy, I would have stopped and I would have said, look, you're killing yourself, man. You're blowing this whole thing called exercise for what? And he was persistent. I was sitting at the light and I was watching him and he was, all the way halfway down the block and he still had his cell phone in his hand and his head down. He's scrolling, he's going through. And I said, we have a problem in the society. You can't take that damn phone and put it someplace so it's not usable while you're doing that. Make sure that if you're tempted, you can't get to it. We got a problem. So here's a young man with his head forward. And what happens? You reverse the bones of your neck. It's called the cervical neck curvature. It goes backwards. And now you're putting pressure on the cord. And you start putting abnormal pressure on those little shock absorbers called the discs. And they start denting into what we call the covering of the cord called the thecal sac. And when that takes place, all kinds of bizarro stuff happens. So now you're putting pressure and stretch in the primary neurological central nervous system, brain, spinal cord, 31 pairs of nerves. Okay, great. So what does that mean? You say to yourself, okay, how does that affect me? Think about this. When you sit at your desk and you got your head in your computer all day long, or you're sitting on your cell phone, you got the tube on, but you're not even watching the television. You're in your phone and your head's down. Do you notice that your arms are heavy? Your hands may be a little tingling. Your legs feel like they're kind of disconnected. Maybe they go to sleep. Maybe get some numbness. Maybe you went to the doc and say, oh, I'm noticing my feet are a problem. And he says, well, you may have neuropathic conditions. And now you go through all this stuff. No, it's your damn phone and your head down looking at your phone all day long. Look, we're going to show you what that is this coming Wednesday evening on the 17th. We're going to show you how to break the habit, the postural positions, things you can do to help yourself. This is not okay. We're seeing so much of it and really concerning to me. When you go to the American College of Rheumatology, they talk about these trigger points that are associated with fibromyalgia. And they're in different positions. They're at the tip of the shoulders and outside on either side, the back of your head. They're in between the shoulder blades. They're at the back of the hips. They're at the where your hips join your pelvis, or your bones, the long bones of your pelvis, the femur heads go in, and in the front, inside the knees, and into the chest area, and so forth. The interesting thing, they all correlate to different positions and different muscle functions that are specific in my world of applied kinesiology relative to organ systems and specific neurological tracking. And I will share that with you this Wednesday evening. And we don't only have a short time today, but I promise you we're going to get into it. And I think you're going to be fascinated. And you're going to say, oh, that's where it's coming from. I didn't know that. So these things relate. Some of them relate to liver function. Some, relate to fight-flight systems. Some of them relate to kidney function. Some of them relate to the central cord, the base of the brain. And you look at it and say, okay, so how did it get there? Well, we're going to fill all that in and let you know. Now, remember I said at the beginning of the program that this condition medically, allopathically, is ruled in by ruling everything out, right? Well, there's actual laboratory findings in fibromyalgia that finger point very specifically to what's going on. The first one, if you will, there's reduced levels. There's reduced levels of some of these neurotransmitters. One we talked about earlier, it's called serotonin. And the serotonin, I said earlier, maybe about 10% or so is produced in the brain stem. And so what does that mean? That means that if you irritate that brain stem, there's going to be a decrease in function. Potentially, maybe, okay? Now, there's two others. One's called epinephrine, and the one is called norepinephrine. They're produced, remember that fight-flight system I told you about earlier? There's called the adrenal glands, It's produced inside the adrenal system. And they're called catecholamines. You can look it up. So I'm just giving you words that you can go and search it, put it on AI and say, hey, Dr. Tom, that's not what AI said. Well, I'm going to send you to a different platform. By the way, Grok is probably the most overall effective AI platform. But, if you ever do AI, you look and you see what? You see, oh, this is Cleveland Clinic. Oh, this is from the World Health Organization. Oh, this is from, and the next question should go through your mind. Don't they have an agenda? And sure they do. Now, so if we know that we have reduced levels of these things, as epinephrine, norepinephrine, maybe, just maybe, we have to start finger pointing to what? The adrenal system, the fight-flight system. It's the inability to protect you, the inability to produce your own steroids. That's what the adrenal glands do. They modulate all kinds of pathways. They work with blood sugar transport in the body. They tell your pancreas, kick up the insulin a little bit. We need more because this goofball put too much sugar in the body. Now, we'll see reduced cortisol. Your adrenal system also produces cortisol. I wonder if the guy's involved in that. Maybe. Now, reduced levels of other things, and they're called branch chain amino acids. They're called valine and leucine and isoleucine. And what these guys do is they help repair and modulate muscle and tissue formation in the body. There's something called substance P. And you say, P, what's that? Well, it stands for pain. And what it does, it transmits the pain sensation reception from wherever the injury is to the spinal cord and then up into the brain. So in this situation, we have an increased level of substance P. And so you got all this, this wind up pain going to the brain, and you say, oh my God, I hurt. So we take a look across the board, and then we look at other things like growth hormone and thyroid stimulating hormone and adrenocortical stimulating hormone and T3, which is a thyroid hormone, and serum cortisol and DHEA and testosterone. Now, look, I said the rest of those guys were depressed, right? They were reduced. Well, the ones I just gave you are all slightly elevated. But so you don't just look at one, you look at them as a group. It's a pattern that shows up. So if you have a pattern of something that begins to tell you, oh my gosh, maybe we ought to pay attention to a couple other things that are going on. So we know that we have central cord problems because your head's bent over. We know that you're depleting your body. Your fight-flight system is getting its butt kicked. And so look, this can be modulated. I've treated thousands of patients over all the years that I've been in practice. And if you really get it and you're willing to modulate, you make a difference, you can shift virtually anything. So join us this coming Wednesday evening, couple of days from now, 3 days from now. And Dr. Scott Lamp and I will give you a tag team on this and show you what you can do to help yourself. So it's going to be 6 p.m. at the Roselle Center in Fairfax. We're right off the National Capital Beltway. And all you have to do to register is go to drtomroselle.com, 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 and register. And you can do it online. Do it the old-fashioned way. Call us. Talk to my staff, 703-698-7117, 703-698-7117. Love to have you. And by the way, we're very proud of our office. Love to show it off to you. Even give you a tour through it if you want to see what else we do in there. It's a great place. But I think you're going to be surprised the damage that technology is doing to us. TechNet is the name of the program, but nevertheless, it's there because it's doing a lot more than just giving you a sore neck. It's giving you all kinds of problems downstream. And you need to stop it. You need to stop now, because it's going to compound over a period of time. So if your body's hurting badly, if it can cause something like fibromyalgia, if it can initiate other problems, don't you want to get rid of it in a nanosecond? Listen, we're coming up to the end of the program, and I wish I could go on for another 3 hours with you and really give you all the details and break it down. But remember, I'm here every Sunday at high noon for one reason only. You need the data, but more importantly, and seriously more importantly, I love you all. You have a wonderful Sunday. I'll see you Wednesday night.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990. Your phone may be destroying your neck. Neck pain, headaches, shoulder tightness, numbness, tingling, and upper back pain are all signs of tech neck, caused by hours spent looking down at phones, laptops, and screens every day. If ignored, the damage can become permanent. Join Dr. Tom Roselle for a powerful free health class and learn natural solutions to relieve pain, improve posture, and protect your spine. Wednesday, June 17th at 6 p.m. at the Roselle Center for Healing. Seats are limited. Call 703-698-7117 or register now at rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.